The aim of our study was to evaluate long-term pouch survival, functional outcome, and patient satisfaction associated with using the same pouch versus when we made a new pouch and joined it to the anal area. As our methods, we used our prospectively collected IRB-approved Redo Pelvic Pouch database. This database dates back to 1988, and we did it from 1988 to 2020. We only included patients with an abdominal approach who had disconnection of the pouch and then a redo pouch anal anastomosis. Over 32 years, there were 462 patients that met this inclusion criteria. 242, or 52.6%, having a pouch repair, and 219, or 47.4%, having a new pouch constructed. This Kaplan-Meier curve shows that the pouch survival after a repair versus a new pouch was similar between the two groups. The pouch function showed that there was no difference in urgency. Pouch function showed there was no difference in incontinence. We use a validated global quality of life score, and after redo pouch, 110 patients, 45.3% in the repair group and 63 or 28.8% in the new group completed at least one of these. When we compared them, there was no difference at all in any of the quality of life domains. In conclusion, our study shows that constructing a new pouch resulted in similar outcomes to disconnection, re-anastomosis, and repair of the index pouch.